So this is a little bit of a video guide on safeguarding your health during perimenopause and menopause and how to potentially think about protecting your heart. Hello and welcome to another edition of the weekly newsletter from Vysana. I'm Dr. Sunny Dhesi, GP, wellness doctor, and as our clinic develops, women's health specialist servicing your needs as both patients looking for skin treatments, for facial rejuvenation, for skin aging, for body rejuvenation and body aging, but also focusing on hormonal health, so your medical health as well, focusing on elements of nutrition and gut health, and also mindset as well. And we roll that all into one into a lot of the treatments that we provide here at Vysana. This week's newsletter coincides with International Menopause Awareness Day, which was on the 18th of October. So I'm unsure whether this came across your feed, across your socials. It is something that we genuinely discuss in clinic almost on a daily basis when you come into clinic for treatments, and obviously giving as much advice as we can during that treatment session time. So I thought I'd focus on menopause, perimenopause, and some of the guidance. This year's, I should say, menopause awareness was more about cardiovascular health, and I'll go into that in a few moments. And I also wanted to concentrate on one aspect of skin rejuvenation using energy-based devices. Obviously, we have the Venus Versa in clinic, and we're going to talk to you about nanofractional skin resurfacing. As I discussed, the focus is about cardiovascular health. It's something that we tend to ignore as we get older until it becomes critical. You know, for example, you go to the GP and you've got high blood pressure, or in a worst case scenario, you get chest pain, you have a heart attack, or you're having severe headaches, or there is a risk of stroke. So cardiovascular health is something that we tend to just associate with, someone's taking my blood pressure, it's high, it's low, and then I don't really want to think about the future of it. As we get older, obviously that reality starts to become a little bit closer. And I think when we're in our 60s and 70s, that reality is too close, and sometimes it's a bit too late to change. And that's why it's really important to focus on women's health and cardiovascular health, because I believe that women's health is failed globally by the system, not by practitioners. And that's why we should be looking at the reason for hypertension, cardiovascular health during perimenopause and menopause. So this is a little bit of a video guide on safeguarding your health during perimenopause and menopause and how to potentially think about protecting your heart. So women face an increased risk of cardiovascular disease after menopause. It's a startling fact, and this is why it happens. So statistics reveal that cardiovascular health, or cardiovascular disease, I should say, becomes more prevalent in postmenopausal women compared to men of the same age. And this shift is primarily due to the role of estrogen in the process. Estrogen, a hormone, plays a crucial role in maintaining heart health. It relaxes blood vessels, it lowers bad cholesterol levels, it reduces inflammation and supports the heart's sort of electrical or conducting system. So high blood pressure, this is the reason why we are now doing blood pressure as part of your routine skin appointments or skin treatment appointments. High blood pressure puts a lot of stress on your heart and blood vessels, increasing the risk of heart disease and stroke. It tends to rise with age, affecting nearly half of adults over 60. So several factors contribute to hypertension, so high blood pressure, including genetics, weight, lack of exercise, poor diet, smoking, and excessive alcohol consumption. So I'll take a little bit of a pause there. So excessive alcohol consumption, really, I feel, and this is what I recommend, and I'm sure I'll get a few rolled eyes whilst you're watching this video, is anything above sort of 15 to 20 units a week. A glass of wine with a meal and having a gap during the week is fine. But I think too often we drink more than that, not realizing that we're consuming more than 20 units a week, maybe up to 30 units a week. And I think that's where excessive alcohol consumption comes in. I always do say to patients that, there's no health warning on alcohol related to the risks of, for example, breast cancer. Those women who consume more excessive amounts of alcohol, their risk of breast cancer increases much more than if you were just on HRT. So estrogen helps keep blood pressure normal by relaxing blood vessels. And when estrogen levels drop during menopause, blood pressure can rise. Lower estrogen levels also lead to heart palpitations and increased awareness of your heartbeat, potentially signaling cardiovascular issues. That doesn't help if you're suffering with anxiety. Coupled with that, you don't know which one to differentiate, which is why I would always, seek advice if you're experiencing those sort of symptoms. And so the question is, can hormone replacement therapy, HRT, help safeguard heart health during menopause? So for most women with high blood pressure, it's safe to take body identical HRT. It can even help sometimes lower blood pressure for some, and regular monitoring is essential. Studies show that starting HRT during perimenopause or within 10 years of menopause reduces the risk of heart disease and death more effectively than some medications. Now, the question that some of our patients have asked is that, well, what about if I'm 10 years after menopause? Well, I'm doing some training with the British Menopause Society, so we'll have an answer for that later on. But the evidence is a little bit more grey, should I say. Statistically, it's not significant, but definitely within 10 years, it definitely does help. So maintaining a healthy lifestyle by checking your blood pressure, taking prescribed medications when you need them, staying active, eating a balanced diet, managing weight, limiting alcohol, obviously quitting smoking, and practicing relaxation techniques like yoga, meditation. All very practical things, but again, it is something that we discuss in clinic. So look, what's the conclusion? It's a little bit long-winded, this video, but I thought it's such an important topic, especially this week as well, is that perimenopause and menopause are critical phases for women's cardiovascular health, not just for the classic HRT symptoms that we are maybe more aware of now, but also cardiovascular health. And we need to understand the risks, considering HRT where it's appropriate, and adopting a heart-healthy lifestyle that you can protect your heart and enjoy a healthier future. So remembering that your heart does matter, and heart attacks and stroke aren't just for men. So I hope that you have found this useful. It was a very quick summary. I think that if you want to discuss anything in clinic, please do. You can book in for a consultation separately as well. But I hope this has been useful, and obviously always look forward to feedback. So lastly, a newsletter wouldn't be complete without focusing on our main passion in clinic, which is skin health. And I wanted to talk more about this little device. So this is a nanofractional device. So this is radio frequencies, microneedling. There are lots of devices on the market. We have stuck by our Venus Versa because it is a great device. And why do we use this form of microneedling? Well, this is non-invasive. So when we put the needles on the skin, they don't penetrate through. Now, my understanding, and I'm always open to feedback, is that a invasive method of microneedling, where the needles actually penetrate the skin, it can induce an excessive amount of coagulation. We never use that sort of microneedling around the eyes because it's more delicate. So I prefer this device because it's non-invasive, it doesn't penetrate the skin. The depth is measured and standard, and it helps to keep that inflammation causing, or that little bit of skin trauma, more to the surface of the skin. So the downtime is less, the healing process is more effective, and this deals with things like pigmentation, sun damage, rough skin, textured skin, fine lines and wrinkles, and most importantly, it helps to resurface the skin. A very good treatment. Downtime is maximum 12 hours. Sometimes different people react in different ways. You do need to have a patch test for this, so and then we do that at least every 6 months. First off, treatments are done very closely together, so one treatment a month for 3 months, and then a maintenance treatment every 6 to 9 months. And very effective for the neck and the face, even the backs of the hands as well. I tend to have this done at least twice a year. Very effective, and I just wanted to share that. So this is a great skin resurfacing treatment, and this is around about the right time to think about that now, or it can be incorporated into the Tribella, which is using IPL, radio frequency, and the nanofractional skin resurfacing. So I hope that you've enjoyed the newsletter. We are sharing the link to our webinar that's happening on the 15th of November, so save that date. And as part of this newsletter, the link for the Zoom talk webinar will be on there as well. So once again, I'm Dr. Sunny Dhesi, and this is Vysana Clinic, Vysana Life. I hope you enjoyed the newsletter. Please do subscribe, please do share, and I look forward to seeing you again next week.